administration of the medication to the eye. Objectives: to directly apply the medication into the eye, to provide means of eye evaluation, to obtain desired therapeutic effects.
Gather equipment. Check medication order against the original physician's order according to agency policy. This comparison helps to identify errors that may have occurred when orders were transcribed. The physician's order is the legal record of medication orders for each agency. Know the actions, special nursing considerations, safe dose ranges, purpose of administration, and adverse effect of the medication to be administered. Consider the appropriateness of the medication for this patient. This knowledge aids the nurse in evaluating the therapeutic effect of the medication in relation to the patient's disorder and can also be used to educate the patient about the medication. Perform hand hygiene to prevent the spread of microorganisms. Wear gloves. Place medication on a tray or move the medication cart outside of the patient's room or prepare for administration in the medication area. Organization facilitates error-free administration and saves time. Transport medications to the patient's bedside carefully and keep the medications in sight at all times. Careful handling and close observation prevent accidental or deliberate disarrangement of medications. Identify the patient by checking the name and identification of the patient's identification band or ask the patient to state his or her name. Identifying the patient ensures that right patient receives the medication and help prevent errors.
Subong ma-perform ta installation, butangan ta eye drops sa mga mata.
Explain procedure to the patient to gain cooperation and to allay anxiety. Offer tissue to the patient. Solution and tears may spill from the eye during the procedure. Cleanse the eyelids and eyelashes of any drainage with a washcloth, cotton balls, or gauze moistened with normal saline solution. Use each area of the cleaning surface once, moving from the inner toward the outer canthus. Debris can be carried into the eyes when the conjunctival sac is exposed. Using each area of the gauze once and moving from the inner canthus to the outer canthus prevents carrying debris to the lacrimal ducts. Tilt the patient's head back slightly if sitting, or place the patient's head over a pillow if lying down. The head may be turned slightly to the affected side to prevent solution or tears from flowing toward the opposite eye. Tilting the patient's head back slightly makes it easier to reach the conjunctival sac. This should be avoided if the patient has a cervical spine injury. Remove cap from the medication bottle, being careful to not touch the inner side of the cap. Touching the inner side of the cap may contaminate the bottle of medication. Invert the monodrip that is commonly used to instill eye drops.
Okay ma'am, tulok sa babaw, focus sa kisame.
Have patient look up and focus on something at the ceiling. By having the patient look up, the procedure is less traumatic and keeps the eye still. Place thumb or two fingers near margin of lower eyelid immediately below eyelashes and exert pressure downward over bony prominence of cheek. Lower conjunctival sac is exposed and lower lid is pulled down. The eye drop should be placed in the conjunctival sac, not directly on the eyeball. Hold dropper close to eye, but avoid touching eyelids or lashes. Squeeze container and allow prescribed number of drops to fall in lower conjunctival sac. Touching the eye, eyelids, or lashes can contaminate the medication in the bottle, startle the patient, causing blinking, or injure the eye. Do not allow medication to fall onto cornea. This may injure cornea or cause the patient to have an unpleasant sensation. Release lower lid after eye drops are instilled. Ask patient to close eyes gently. This allows the medication to be distributed over the entire eye. Instruct the patient not to rub affected eye. This prevents injury and irritation to eye.
Hindi pag-usog ang mata ta ma'am ha, para ma-avoid ang irritation. Sige ma'am, muklat na ma'am.
Assist patient to comfortable position. This ensures patient comfort. Perform hand hygiene. Hand hygiene deters the spread of microorganisms.
For the evaluation, patient cooperates with installation of eye medication, desired therapeutic effects is obtained, experiences no adverse effects including allergy response, systemic effects, or injury.